Greetings everyone, welcome to today's enlightening video on Dr. Nguyen channel. We're delving into a crucial health topic, stroke. This isn't just another health topic, it's a matter that could impact anyone, anywhere. Throughout this video, we'll explore the definition of a stroke, its causes, how it's diagnosed, treatments available, prognosis, and ways to prevent it. Each piece of information could be a life-saving nugget of knowledge. So, buckle up for this journey of understanding. Now let's start by defining what a stroke is. So, what exactly is a stroke? Well, a stroke occurs when blood flow to a part of your brain is cut off. Without oxygen and nutrients from blood, your brain cells start dying within minutes, which can lead to long-term damage, disability, or even death. There are two main types of strokes, ischemic and hemorrhagic. Ischemic strokes, the most common type, happen when blood clots or other obstructions block blood flow in the brain's arteries. Hemorrhagic strokes, on the other hand, occur when a blood vessel in your brain leaks or ruptures. Now, let's talk about the basic physiology behind a stroke. Your brain, although it accounts for only about 2% of your body weight, uses up around 20% of the oxygen and nutrients your blood carries. When a stroke strikes, the affected area of the brain can't get the resources it needs, leading to cell death and potential loss of function. Understanding the causes of stroke is vital in preventing it. So, what causes a stroke? Strokes can be caused by a variety of factors. Let's delve into the intricate world of stroke causation. We'll start with lifestyle factors, the choices we make every day that could potentially increase our stroke risk. These include smoking, excessive alcohol consumption, poor diet, and a lack of regular physical activity. Yes, the little things we often overlook can add up and make a big difference. Medical conditions play a significant role too. High blood pressure, for instance, is a major player. It's the leading cause of stroke, often referred to as a silent killer because it goes unnoticed until it's too late. Diabetes, high cholesterol, and heart disease are other medical conditions that can lead to strokes. Now, let's not forget about genetic factors. Some of us are predisposed to strokes due to our family history. If your parents or grandparents had a stroke, your risk might be higher than someone without this genetic link. It's not a certainty, but it's a factor to keep in mind. In some cases, strokes can occur without any clear cause. These are known as cryptogenic strokes. They remind us that the human body is an intricate and sometimes unpredictable system and that there's still much we don't know about strokes. Diagnosing a stroke early is crucial to effective treatment. Let's discuss how strokes are diagnosed. Strokes require immediate medical attention and accurate diagnosis. Upon arriving at a hospital, doctors will first conduct a physical examination. This involves assessing the patient's vision, balance, coordination, strength, and sensation. They'll also check for telltale signs of stroke, such as a drooping face, arm weakness, and speech difficulties. Next, various imaging tests are used to see what's happening in the brain. Computerized tomography or CT scans provide a clear image of the brain, showing any bleeding, blood clots, or damaged brain cells. Magnetic resonance imaging, or MRI, uses magnetic fields and radio waves to create detailed images of the brain. These images help doctors identify the type and location of the stroke. Then, there are blood tests. These help doctors determine your blood's clotting ability, which can directly affect the type of stroke you might be having. The levels of certain blood chemicals can also influence your risk of having a stroke. In some cases, other tests may be used. These include cerebral angiogram, which visualizes the arteries in your brain, and an echocardiogram, which identifies sources of clots in your heart that may have traveled to your brain. Each diagnostic test provides a piece of the puzzle, helping doctors understand the type, location, and cause of the stroke. By determining these factors, they can design the most effective treatment plan for each individual patient. With a correct diagnosis, effective treatment can be implemented. Let's discuss the treatment options for stroke. Treatment for stroke is aimed at restoring blood flow and minimizing brain damage. Now let's delve into the various methods that health professionals employ to achieve these goals. The immediate treatment for stroke typically involves medications. An ischemic stroke, which is caused by a clot, may be treated with clot-busting drugs, like tissue plasminogen activator, or TPA. This medicine works by dissolving the clot and restoring blood flow to the impacted part of the brain. However, it's crucial to administer this drug within the first few hours after the onset of stroke symptoms to maximize its effectiveness. In some cases, doctors may also use a procedure called endovascular therapy. Here, surgeons thread a long tube through an artery in the groin up to the blocked artery in the brain. The clot is then removed or dissolved, reinstating the blood flow. For hemorrhagic strokes caused by bleeding into the brain, the treatment approach is a bit different. Medications or surgery may be used to reduce pressure in the brain and control bleeding. In certain cases, surgical clips or coils may be placed to prevent blood vessels from bursting again. Once the immediate crisis has passed, the next phase of treatment begins: rehabilitation. This is a crucial component of the recovery journey, as strokes often cause temporary or permanent disabilities. Depending on the severity of the stroke, rehabilitation might include physical therapy to regain strength and coordination, occupational therapy to relearn everyday activities, and speech therapy to address issues with language and swallowing. However, it's important to remember that each stroke is unique, and so is each patient's journey to recovery. The treatment plan is tailored to the individual's needs and abilities. It's a team effort involving doctors, therapists, nurses, and most importantly, the patient and their loved ones. The prognosis of a stroke depends on various factors. Let's explore this topic next. This is a vital piece of the puzzle as it helps to set expectations and guide the next steps of the journey. Stay tuned as we unravel this aspect in the following scene. The outcome of a stroke can vary widely. Much like other medical conditions, several factors come into play when predicting the prognosis of a stroke. Firstly, the type of stroke can significantly influence the outcome. Ischemic strokes, caused by a blockage in the blood vessels, generally have a better prognosis than hemorrhagic strokes, which occur due to bleeding in the brain. Secondly, the extent of brain damage is a critical determinant. The larger the area of the brain affected, the more severe the consequences. For instance, a stroke affecting the left side of the brain can lead to paralysis on the right side of the body, problems with speech and language, and slow, cautious behavior. Whereas a stroke affecting the right side of the brain may cause paralysis on the left side of the body, vision problems, and quick, inquisitive behavioral style. Lastly, the overall health of the patient plays a pivotal role in recovery. Patients with good health before the stroke are more likely to have a better outcome. Other factors such as age, sex, race, and family history can also influence the prognosis. Rehabilitation plays an integral part in helping individuals regain lost skills and learn to cope with any residual effects of the stroke. Remember, every stroke is different, and each person's path to recovery will be unique. Lastly, let's talk about how you can prevent stroke. Preventing a stroke is much better than treating one, a sentiment that rings true for most, if not all, health conditions. So let's delve into the strategies we can employ to keep strokes at bay. Firstly, lifestyle modifications. A healthy lifestyle is your first line of defense. Regular physical activity, a balanced diet, limiting alcohol, and abstaining from smoking all contribute to reducing your risk. Active living and nutrient-dense foods like fruits and vegetables can help maintain a healthy weight and lower blood pressure, while avoiding tobacco and excessive alcohol protects your blood vessels. Next, let's talk about medications. For some, lifestyle changes may not be enough, and that's perfectly okay. If you have certain conditions like high blood pressure, diabetes, or high cholesterol, medications can be a crucial part of your prevention strategy. It's crucial to work with your healthcare provider to manage these conditions effectively. Lastly, regular medical checkups. These allow for early detection of any potential problems and enable timely intervention. Remember, the sooner a potential risk is identified, the sooner it can be managed. Let's not forget, however, that every individual is unique. What works for one may not work for another. Tailoring these strategies to fit your needs and circumstances is key. It's all about taking proactive steps to safeguard your health. In conclusion, a stroke can be a life-altering event, but it doesn't have to be. With the right lifestyle modifications, appropriate medication, and regular medical checkups, you can significantly lower your risk. Prevention is certainly the best cure when it comes to stroke. In summary, a stroke is a serious medical condition, but with knowledge comes power. We've journeyed through the intricate landscape of strokes, understanding its definition, uncovering its causes, exploring diagnostic methods, discussing treatment options, contemplating prognosis, and learning about prevention. This wealth of information empowers us to take charge of our health. Thank you for joining us today. Remember, staying informed is your first line of defense. Stay healthy.